Hello, everyone. My name is Nick Alonge. Welcome to our fourth interview on the attitude of technicians in today's new norm, brought to you by WeTeamUp. Today, my guest is Mark Ferguson. How you doing, Mark?
Hey, Nick. I'm good. How about yourself?
Doing awesome, man. Welcome to the show. Tell us a little bit about yourself, please.
My name's Mark Ferguson. I'm the general manager of Vulcan Custom Dental. We are the milling center for BioHorizons implants. Background is I'm a dental technician. Been in for a couple decades. Spent a lot of time doing digital dentistry, and met the guys from Sierra many years ago, and it's been a great relationship ever since.
Awesome. So I've got a couple questions lined up I want to ask you. First one we're going to go with is, in your experience, what changes have you observed in the impact of today's dental industry, specifically, digital?
It's really interesting with what's going on in our industry right now. I think there is going to be a bigger push for digital coming out of this as part of kind of a safety issue. I was recently talking to our sales manager in the UK, and they're expecting a big push to digital coming as they're about to go back to work for safety and for efficiencies. We don't know how fast work's going to come back in coming out of the coronavirus situation. So basing your workload, how can you be more efficient? How can you prepare going forward? Digital affords many efficiencies, affords many accuracies, and we'll see how people are able to take those advantages and make some great restorations moving forward. It should be fun.
Yeah, I agree with you. I think the digital is going to take off just because the time it takes for impressioning, waiting there, and the seat time for the patients in chairs, you're probably going to see get reduced a little bit, or, the cases of, re-prepping compared to pulling something out and putting an implant might be the new norm just because of safety issues and lack of the mist that's going into the air and everything else.
Yeah. So, and just less exposure to that mist, when you're standing a little bit further back and actually, digital impressioning, you're looking at the computer screen instead of looking in the patient's mouth. You're not keeping your fingers in there, keeping the pressure and things like that. So I think there is some definite safety advantages for digital on the clinical side.
Yeah, I thank you for sharing that. I didn't really think of all that. So what kind of feedback are you getting from the clientele that you have right now?
So our clientele is generally dental labs, and I've talked to a few of them over the past few days. Some of them are back to as high as 70% of their workload pre-coronavirus. That was really encouraging. We're certainly not there yet where we are here, but we're seeing a bigger workload every day. As a milling center, for us, we expect to follow a few days behind the labs because labs got to get the designing done or the models poured up or what have you. But I think in talking to some of them, a lot of them aren't expecting to rush past 70%. The clinicians are not going to be able to see as many patients. Just with time for changing out their own PPE and sterilization of operatories and things like that. If they might be able to see 66 to 75% of the patients that they would have on a normal day previous. So that's going to change also. I think, the clinicians have been off work for a couple months. Some of them, my brother included, laid off their staffs. And what procedures they decide to do coming out of this, it should be interesting to see as well. I think you're going to see, this is just my own personal opinion, I think they're going to see more higher dollar clients sooner, just to make up for the time that they've been off. So
yeah, that was kind of the next question I was going to ask is, do you see it coming back fast, slow, what to expect? And I agree with you that the bigger cases, I think, was what I'm seeing from labs getting in is that we need these full arch cases because we need to pay our bills quicker. Not the single crown or the the cleaning per se. It's full mouth reconstructions seem to be the quickest thing I've noticed coming back with a small handful of people I've spoken to over the past 2 weeks.
Yeah, and I think that's, you're going to see that widespread, particularly with the labs that are doing the full arch stuff. I think you might find some doctors that, doctors generally have anywhere from 3 to 5 labs that they use, and they might have that one for full arch that really specialize in it, but they might at this time try and kind of work their finances a little bit and maybe use maybe a different lab. So it's a time where if you've been doing the full arch stuff, you can really cement those relationships. It might give some labs that weren't doing as much of it a little bit of an opportunity to get into it. I don't think everything's going to I don't think we're going to totally rebound from over the year. And in my conversations, most labs, us as a milling center included, we were killing it for the first quarter. But if you had revenue projections throughout the year, even if you were 30% up before this whole thing, and just missing 2 months, it would be surprising to me for people to really hit their revenue goals by the end of the year. I think some places will get close, and those places doing the more full arch type cases, they might be in more demand, so they probably have a better shot at it. So
yeah, I agree. I mean, when we were speaking back at midwinter, we were both doing great. I mean, it was very lucrative for everybody, and the amount of work we were putting in for, I felt justified for the income that we were getting because we were really pushing it. And all of a sudden, come mid-March, nobody's doing anything. And it was a very halting stop for, us in our industry of not directly making crown and bridge work, or prepping people's teeth. We're indirectly affecting the patient with me with the tooling side and you with the abutment side, that we have that trickle down effect. I mean, we didn't see our problem hit until mid-April because people stopped ordering tools, and I'm projecting you'll get started up, and then about 2 weeks later, we'll start getting our orders back in because that's when cases are back going through the labs and they can afford their bills, that type of thing. So do you have any advice on this particular situation from everybody you've talked to, and collectively maybe have some positive affirmations to give people?
I think, one of the things that I keep going back to is that everything was so good up until midwinter or a little bit after, and there was so much work for everybody. And our industry as a whole was really coming together. There was a lot more sharing, a lot more team approach. And, you didn't see a lot of the fighting for work. And I think over the past month, I've, like everybody else, have been watching a lot of webinars and things like that. You see some people sharing some great stuff. I hope as people are coming out of this, the virtual relationships, either through Zoom or Facebook or social media, whatever, continue to grow. And as an industry, we can continue to get closer and tighter knit, and not go back to the last economic crisis where it seemed a little bit, maybe not the best word, but a little snippy about, oh, you're using them or whatever. Yeah. And people were holding their cards a little closer to the vest about what they were doing. I think we were getting to the point where there was so much sharing. I really hope that continues.
Yeah, I agree. I mean, I remember there being 2 big competitors when it came to design software. One team hated the other team. Now I notice a lot of people both own both softwares and utilize them to their advantage, which is completely different than just 5 years ago when people are like, I'm better and I'm better. And now it is a group effort to become successful. I like that because everybody wins when you're sharing information like we've been doing. And that's kind of why I'm doing these interviews, is to get people that don't usually get to talk too much, express themselves, tell them what they think, because you may have a great idea that somebody else also does, and then you guys can connect. And that brings me to kind of ending this up a little shortly, because we've been together. I really appreciate your time. I know you've been really busy, and your perspective on all this. If anybody wants to get in touch with you, how would they do that?
Well, they get me through email or through calling Vulcan Custom Dental. My email is mferguson@vulcandental.com. Our website is vulcandental.com if they're interested in what we're doing here. As I said previously, we're the milling center for BioHorizons, so we're milling authentic BioHorizons and Camlog. Through this downtime, we've developed a relationship with ELOS, and we're about to launch competitive platform, ELOS authentic connection abutments and hybrid bases and things like that. So any questions, we are very open about what we do and how we want to help the labs provide the best product to their dentists. So please reach out. See my phone number on there as well. So please don't spam text me or whatever.
So thanks, Mark. I appreciate it all. And everyone, thanks for watching. And I look forward to talking to you guys again.
Thank you, Nick.